The CIA requires that we report to the OIG within 5 days the change in the compliance officer or a change in the compliance officer position description or any actions or changes that have occurred that would affect my ability to perform my job under the CIA obligations. Let's talk a little bit about the requirement for an independent review organization. The independent review organization, or as I mentioned, it's called an IRO, is exactly that. It's someone that United must retain to review our focus arrangements tracking system and to conduct an audit or a review of any new or renewed focus arrangement contracts for lithotripsy, XPS, HPS laser. The IRO will audit a random sample of 25% of new or renewed contracts for the reporting period. The IRO must be someone that is knowledgeable in anti-kickback statute and Stark law. We just recently had our IRO in last week. Some of you may have seen that we had a couple of visitors. That was the IRO, and they conducted their audit of our focus arrangements. They audited 23 of our laser contracts and 16 of our lithotripsy agreements, and we did very well during that audit. But the IRO now will prepare a report, and they've also finished their audit of our system review, and they're going to prepare a report on that as well, and then they submit those reports to the OIG. What if we fail to comply? If we fail to comply fully and timely with our CIA, there are stipulated penalties of $2,500 per day for the failure to do or have any of the following: a compliance officer, a written code of conduct, written policies and procedures, training, focus arrangement procedures and or focus arrangement requirements, a disclosure program, notification of governmental investigations or legal proceedings, reporting of reportable events, engagement of an IRO, or if we would fail to submit a report that is due under the CIA. There's a $5,000 per day penalty if we falsely certify any of our reports to the OIG, a penalty of $1,500 per day for failing to grant the OIG access, and a penalty of $1,000 per day if United does not fully and adequately comply with our obligations under the CIA. So it's very serious if we don't comply with the CIA, because there are penalties that can be imposed. If there's a material breach of the CIA, United and its managers could be excluded from participation in the federal health care program. A material breach would be our failure to report a reportable event, to take corrective action and make appropriate refunds. We're going to talk a little bit later about this, but Medicare now requires that refunds are made within 60 days, or if the OIG had asked us to refund any money and we neglected to do that, that would be considered a material breach, or a repeated or flagrant violation under the CIA. Our failure to respond to a demand letter regarding penalties, or our failure to engage and to use an IRO. Now we're going to talk a little bit more specifically about our compliance program. United has had a compliance program in place for many years, but last year it was reviewed and updated to comply fully with our CIA. Our compliance program facilitates the establishment of a culture within United that promotes the prevention, detection, and resolution of instances of conduct that do not conform to federal and state law, federal and state and private payer healthcare program requirements, as well as our own ethical and business practices. One of United's core values is integrity. We promote a corporate culture that is consistent with the highest moral and ethical principles in our relationships, whether those relationships be with our patients, our physicians, our facility partners, our vendors, or with each other. You have heard many times the phrase, "do the right thing." This has been our corporate message from our managers on down since our inception. One of the most important components of the compliance program, and really at the core of it, is our code of conduct. The code of conduct affirms our commitment to fully comply with all federal and state health care program requirements. United's code of conduct sets the standards for our employees and our physicians in the conduct of our business. All covered persons, employees, the managers, leased employees, PRN employees, and all physician investors must comply with all federal healthcare program requirements and United's policies and procedures. All covered persons must sign an acknowledgement that they have read and understood and will comply with the code of conduct. The code of conduct requires all employees and physicians to comply with all federal healthcare program requirements and with United's policies and procedures. If you do not comply, it will be reflected in your performance review. Promotion of and adherence to the code of conduct is an element in evaluating the performance of all employees. Some general matters that are covered in United's code of conduct apply to physician conduct. Since our lithotripsy company is a physician-owned company, United Urology Centers, United provides disclosure information to our patients regarding physician ownership. You may have seen this disclosure. It's in our patient consent forms. Physicians will not negotiate business on behalf of United. Physicians will not receive any payment in cash or in kind for the referral of patients. It's illegal and it's also unethical to offer or solicit any financial inducement, gift, or anything of value to prospective patients or others to encourage patients to be treated at United. We also do not disclose any information regarding the number of cases a physician performs to anyone other than that individual physician. If requested, we can tell a physician what his or her own case volumes are, but not the case volume of any other physician. And you might wonder why we can't do that, but there are times when, and I know in the past, physicians may have called me and they wanted to know how much another doctor, how many cases they were doing. And the reason they wanted to know is they wanted to make sure that they were doing, their share of the load. And they may go back to that physician and try to get them to do more. And so that is just something we cannot tell our physicians. We can tell, though, it is permissible to tell our physician investors the total number of cases that the company does in a month or in a year. It's not permissible to require a number of cases to be performed before permitting a physician to invest in the company. And likewise, it is not permissible to use case volume to determine if a physician may purchase additional investment interests. We have a sale of membership interest policy, and it's applied consistently and fairly to all of our physicians. Another element of the code of conduct has, Bruce?
I have a question. I met with a physician last week, and I was talking to him about the facilities in his area, 3 different hospitals. And I didn't tell him the contract rates, but he specifically asked me if he could have copies of those 3 contracts. And I told him that, we can't.
Right, there would be no reason for that physician to have copies of the contracts. If you wanted to know like the schedule of services but I can see no reason that we would give that. So very good. You handled that just correctly.
I'd say not only as far as compliance goes would I not do that, I think that's a poor business practice. That's proprietary information. So
right.
I would have never wanted. That's within the company alone, and there's no reason for them to do that.
But physicians do ask that, and a lot of times they'll want to know specifically what our case rate is at a hospital, and we don't tell them that either. They do not need to know what we get paid. We'll talk about the employment part of our code of conduct. At United, we recognize that our greatest strength lies in the efforts and talents of our employees. We provide an equal employment opportunities to current and prospective employees that are based solely on merit, qualifications, and abilities. United values its employees and will pay employees fairly and will provide a safe and healthy work environment. United prohibits any individual from engaging in any act or form of harassment of any other individual on the basis of that person's color, race, religion, national origin, handicap, or sex. So we follow all the labor laws here. Another aspect of the Code of Conduct involves quality of care. At United, delivering exceptional patient care is the core of our mission. We have a patient bill of rights that includes the mandate that all patients will be treated with respect and with dignity. All treatment we provide will be medically necessary, and we will make no distinction in the care we provide based on one's ability to pay. All employees will be licensed, credentialed, and skilled for the services they perform as required by law. United will comply with all laws and regulations regarding patient rights and privacy, including the Health Insurance, Portability, and Accountability Act of 1996, or HIPAA. On a periodic basis, through its QI and Compliance Committee, procedures and standards will be reviewed to ensure that the patient care we provide at United remains of superior quality. The Code of Conduct provides a brief summary of a more detailed confidentiality, non-compete, and conflict of interest policy standards. And every year, we provide our employees with an addendum to that policy that they must sign. Jackie actually has them today for everyone. Basically talking about, that we would all adhere to this policy of confidentiality, non-compete, and conflict of interest standards. Employees must avoid any personal interest or association that may be inconsistent or even appear to be inconsistent with their dedication to serving the best interests of the company. United's ability to compete with others and its choice of those with whom it may do business must not be reflected by the personal interests of any one employee. Employees are required to report any actual or potential conflict of interest that arise in connection with any offers of incentive payments or free items or services offered by suppliers or our vendors. There can be no offer asking for paying or receiving anything of value in return for the referral of patients. Employees cannot accept gifts from facilities or vendors. Only items of a nominal value would be okay. Marion always talks about cookies at holiday time. Policy guidelines must be followed for the entertainment of hospital personnel. On rare occasion, it is okay to take someone from a hospital out to lunch to discuss a contract. However, what you may find is that hospital person isn't able to go out because they're also held under similar standards with their own conflict of interest policy. United may provide refreshments or sponsor a dinner to make a pitch to potential investors, but the value of that meal per our policy should not exceed $100 per person. No other thing of value, such as bottles of wine, gift cards, or gift certificates, may be provided to potential investors. No spouse or guest can attend unless the office person that is invited to attend is pertinent to the topic that's being discussed. For instance, if you had an office manager attend a meeting and you were talking about how to schedule cases, that would be